Good morning, everybody. This morning we have another topic lectures on epidemiology and public health. Today we are going to do oral indices. What do you mean by oral indices? Okay. For these oral indices, the learning outcomes will be we should expect the student to have a general characteristic of indices, to understand the purpose on use of indices, to understand the various classifications of indices, and to record the OHIS indices. Okay. As an introduction, until you can count it, weigh it, or express it in quantitative fashion, you have scarcely begun to think about the problem in a scientific fashion. By Lord Kelvin. And what do you mean by quantitative measurements? Quantitative measurements of a disease most commonly relies on indices. Definition of indices. An index has been defined as a numerical value describing the relative status of a population on a graduated scale with definite upper and lower limits, which is designed to permit and facilitate comparison with other populations classified by the same criteria and method. By Russell al. 1978. And for an objective of an index, 1. The main purpose of an index in a dental epidemiology is to increase understanding of the disease process, thereby leading to methods of control and prevention. 2. It attempts to discover populations at high and low risk. 3. It helps to define specific problem under investigation. And in ideal requisite of an index. This is very important. An index should have clarity, simplicity, and objectivity. An index should have validity. Third one, an index should be reliability. The fourth one, an index should have quantifiability. The fifth one, an index should have sensitivity. And sixth one is it should have acceptability. What do we mean by clarity, simplicity, and objectivity of an index? It should be reasonably easy to remember and apply. Second one, it is clear and unambiguous. And third one, it is mutually exclusive categories. Validity of an index means must measure what it is intended to measure. So, it should correspond with clinical stages of the disease under study at each point. The third one, an index should have reliability. It should virtually synonymous with reproducibility, the ability of the same or different to interpret and use the index in the same way. And the second one, it should measure consistently at different times and under a variety of conditions. Okay. The fourth point for index is you must have quantifiability. It should be amenable to statistical analysis so that the status of a group can be expressed by a number that corresponds to a relative position on a scale from 0 to the upper limit. The fifth one, an index should have sensitivity, should be able to detect reasonably small shifts in either direction in the group condition. And the sixth one, acceptability. The use of an index should not be painful or demeaning to the subject. As for criteria for selection of an index, it must be simple to use and calculate. It permits examination of many people in a short period. It requires minimum armamentarium. It should have criteria which defines its component, clear and readily understandable. The index should be free from subjective interpretation. An index should define clinical condition objectively. It should be highly reproducible when used by one or more examiners, amenable to statistical analysis, strongly relate numerically to the clinical stage of the specific disease under investigation, equally sensitive throughout the scale, and should not cause discomfort to the patient. Okay, now we come to classification of indices. 1. Based on the direction in which the scores can fluctuate, either it irreversible index, where the index that measures condition that will not change. Example, dental caries index, DMFT. Okay. Reversible index, where the index that measures conditions that can be changed. Example, PDL indices. Okay. 2. Depending on the extent to which areas of oral cavity are measured. If a full mouth indices measure the patient's entire periodontium or dentition. Example, Russell's periodontal index or PI. Our simplified indices measure only a representative sample of the dental apparatus. Example, oral hygiene index simplified, OHIS. The third one, classify under certain general categories. Example, disease index, where it is D for decay in the MFT, and the symptom index, where it's measuring gingival or circular bleeding. Okay, another one is a treatment index, F, which is field in the MFT. Okay, the fourth one is index can be classified under special categories. One is simple index, an index that measures the presence or absence of conditions. Example, Silness and Lou plug index. Okay. The second one is a cumulative index, where it measures all evidence of condition, past and present. Example is DMFT index for dental caries. Okay. For individual patients, an index can provide individual assessment to help a patient recognize an oral problems. Okay. Reveal the degree of effectiveness of present oral hygiene practices. Motivate the person in preventive and professional care for the elimination and control of oral diseases. And the fourth one is evaluate the success of individual and professional treatment over a period of time by comparing index scores. The fifth one, provide a means for personal assessment by the dental hygienist of abilities to educate and motivate individual patients. Okay. The use of index in research. 1. To determine baseline data before experimental factors are introduced. 2. Measure the effectiveness of specific agents for the prevention, control or treatment of oral conditions. 3. Measure the effectiveness of mechanical devices for personal care, such as toothbrush, interdental cleaning devices, or water irrigators. And the use of index in community health. An index can 1. Show the prevalence and trends of incidence of a particular condition occurring within a given population. 2. Provide baseline data to show existing dental health practices. 3. Assess the needs of the community. Compare the effects of a community program and evaluate the results. Okay. Okay. Now we can classify the index depending on the diseases. We can classify it under indices used to record oral hygiene, indices used for gingival disease, indices used for periodontal diseases, index used for tooth mobility, indices used for dental caries, indices used for enamel defects of tooth, indices used for malocclusions, indices used for dental fluorosis. 9. Index used for erosion, indices used for oral cancer, indices used for craniomandibular diseases, indices used for geriatric oral health assessment, and 13 is index used for assessment of prosthesis hygiene. Okay, there are many indices that can be used, but there is a pro and contra of one index from another. So it's up to us to choose which are a more suitable index for a certain patient or a certain survey of a certain population, depending on the why you do the survey, the purpose of the survey. Alright, so here we see that indices used to record oral hygiene, plaque-free score, oral hygiene index (OHI), which is mostly used, or simplified oral hygiene index, plaques index, patient oral hygiene performance index, Tureski, Gilmore, and Glickman modification of Guillet plaque index. 7 is modified navy blue index. Modified navy plaque index. 8 is plaque control record. 9 is personal hygiene performance index. And 10 is modified personal hygiene performance index. There are some more. 11 is oral health status index. 12 distal mesial plaque index. 13 bonded bracket index. 14 University of Mississippi oral hygiene index. 15 calculus surface index, calculus surface severity index. 17 probe method of calculus assessment. 18 marginal line calculus index, and 19 standardized fall technique of calculus assessment. Okay. Now number 2, we have indices used for gingival diseases. There are big numbers, but we use a few only. Okay, indices used for assessment of gingival bleeding, gingival fluid flow index, sulcus bleeding index, bleeding point index, gingival bleeding index, papillary bleeding index, gingival status index, quantitative gingival bleeding index, and interdental bleeding index. And 3, we have indices used to assess gingival inflammation. Papillary marginal attachment index, gingival index, modified gingival index, papillary marginal gingivitis index, gingival tissue index, gingival pain index. Tooth mobility index, Muhammad index, Picton index, Parfit index, Cowboy and Cowboy index, O'Leary and Root index, and Green index. 6.1 Indices used to record dental caries. Wow. One of the most important record that we use, or indices that we use, is this, the first one, decayed missing filled teeth, DMFT. It can have modified DMFT index or WHO modification of DMF index, or decayed missing filling surface index, or DMF surface percentage index, or Caries indices for primary dentition, or you have DEF index for primary dentition, DMF index or DF index. Second one, you have Czechoslovakian Caries index, and third one, you have restorative index. The fourth one, you have root caries index, caries severity index, functional measure index, and dental health index. Significant caries index, SIC. This is also much used, and WHO caries index. Okay. 7. We have these indices used for enamel defects of tooth. We have development defect of dental enamel index, tooth wear index, TWI, abrasion index, modified development defects of enamel index, hypocalcification or hypoplasia index, simplified hypoplasia index, and individual tooth wear index. The 8th one, we have indices used for dental fluorosis. First one, we have Dean fluorosis index, 2 community fluorosis index, 3 Molars dental fluorosis index, 4th Young's classification, 5 Al-Alozi classification, 6 Tistrop and Fajakov fluorosis index, 7 Murray and Shaw classification, 8 tooth surface index of fluorosis, and 9 fluorosis risk index, and 10 chronological fluorosis assessment index. Okay, indices used for mal occlusion. We have Masler and Freckle index, occlusal feature index, mal alignment index, handicapping labiolingual derivation index, handicapping malocclusion assessment index, standardized technique for recording and alignment of individual index, index of orthodontic treatment needs, IOTN, this is very much used, standardized continuum of aesthetic need index, Norwegian index of orthodontic treatment needs, peer assessment rating index, and dental aesthetic index. The 9, you have indices used for oral cancer, that is classification and staging of mouth cancer and jaw tumors. And 9, 10, and 11, you have index for geriatric oral health assessment, that is COHI. Okay. I need you all to do an assessment with a reference books, this by Soben Peter, Essentials of Preventive and Community Dentistry. The fourth edition. The one that I have is the fourth edition, June 2009. The topic is on Indices in Dental Epidemiology, page 313 to 359. What I want to do is to write assignment on OHIS, DMFT, DMFS, DID and WHO modification, SIC index, BEWE index, MGI index, CPI index, IOTN index, and DIN fluorosis index modified. Okay, these are the assignment that I need you. You must do it handwritten, not by typing it in your computer. And please have the pictures or the graph or whatever that is to explain your index. Okay, by doing this, it will be very good for you, so that you will know what are the index to use when you need to do some survey or some research work when you will come to the PIDC. Okay, these are the things that I need you to do, and your assignment will be part of the program for community dentistry. This is one of the first assignment that you need to do. Alright, all the best to all of you. Hope I can receive your assignment soon, and thank you for your time. Thank you again.